Hi, my name is Omalara Ajayi, and I am presenting to you a case on anterior knee pain. So the patient I'm presenting on, she is a 13-year-old female who is in middle school. She's a softball player, and she is a camp counselor. She came to us on 24th of July with a referral diagnosis of bilateral knee pain. Her chief complaints were knee pain and swelling in both knees. Her right knee was swollen first, and then she said 2 weeks later her left knee became swollen. And those are her photo scores. And this is pretty much where her pain was, both knees. The deep ache, she said, kind of medial and anterior, and she denies any numbness and tingling. These are structures which could be a source of symptoms. So I listed rheumatoid arthritis as my primary hypothesis because initially when she was letting me know about her symptoms, she said that it just came on one day that her right knee was swollen, and then 2 weeks later her left knee was swollen. She didn't have any injury or any she didn't experience any pain. So, and also her mother told me that her doctor decided to do some blood tests because of swelling in both knees. And I also put a meniscal injury since she is a softball player. She was playing softball a couple days before she noticed the swelling. So I put that as one of my hypotheses, and also patellofemoral pain, because that could also be a cause for her symptoms. So her aggravating factors were standing for a long period of time, playing softball. She is a pitcher, but a couple of days before she noticed her right knee was swelling and she was playing catcher. She was substituting for another player. And another aggravating factor was squatting, and easing factors was ice. So she has no difficulty with sleeping. She does wear a knee brace during games and practice sometimes, not all the time. And so, as I told you before about her mechanism of injury, she was playing catcher a couple of days before she noticed her right knee was swollen. She usually plays pitcher. She played for, it was a couple of hours, or a few hours actually, that she was playing catcher in a game. So she said it's getting better, and she has no prior history of this. Her medical history is unremarkable. No red flags, yellow flags. She was taking prednisone for the swelling, and they did she had an MRI also. Asterisk signs I'll use from the history is pain with squatting, since she was playing catcher that involves a lot of squatting. So use that, and also the amount of swelling she has, and standing for longer than 1 hour. She also did say that standing for a long period of time, she gets pain with that, and that was one of her goals, being able to stand for a long period of time, because she was beginning to become a camp counselor, and that involves a lot of standing, and also going down the stairs was painful. I decided to rule out RA as a hypothesis because her history does not fit the diagnosis, and I do believe her problem is more musculoskeletal. So my primary hypothesis is a meniscus injury, and my secondary hypothesis is patellofemoral pain. Her severity is moderate. She only experiences pain mostly during softball games and practice, and her pain is 5 out of 10 at worst. She is not very irritable, and her problem, as I said before, is more musculoskeletal in nature, and her symptoms are getting better and are stable and reproducible. With my primary secondary hypothesis being meniscal injury and patellofemoral pain, I decided to use the Deathleys and the McMurrays and the Clark sign to rule in and out my hypotheses. And what I plan to assess is her functional movement with squat and step up, and also her hip strength. She did present with mild genu valgum. She had medial collapse of her knees with a deep squat, so she didn't have any hip abductor strength with when performing a squat. I cleared her lumbar, and everything else was within normal limits, and her pain at worst was 5 out of 10. She was tender to palpation in the inferior aspect of her patellar. Manual muscle tests, her glute me's were 4 out of 5. She did present with the weak hip abductors when she performed a squat. And her special test, she had a negative McMurray's and a negative Deathleys, but positive Clark sign. At this point, my findings have led me to a diagnosis of patellofemoral pain. Her asterisk signs I will use are pain with squatting and stair climbing, the amount of swelling, and standing for a long period of time. So day 1 treatment included patellar mobilizations, inferior glides, and tibia posterior mobilizations for extension, and lower extremity strengthening exercises. It was a little painful with the mobs, and she was sore after exercising. So the exercises that were included were glute strengthening exercises. I also gave her a home exercise program and told her ice at home, and also to rest for a couple of days to let her symptoms calm down. I did notice a little change in pain with a deep squat after patellar mobilization. I was thinking about 4 weeks was good enough for, because she was young, and she seemed like, well, her mom's there, so I'm going to keep her compliant with her home exercise program. And she wasn't as irritable, and there was no precautions. And my plan for assessment on day 2 was to reassess her functional squat for strength and pain. On her next visit, she reported that she was sore from the exercises, but she has no knee pain. She also reported that she had some pain while sitting with her knees bent for a long period of time, and she also had pain and grinding with a functional deep squat. On the same visit, I continued with the same treatments. It wasn't as painful as it was on her previous visit, and there wasn't really any change besides less pain. And I plan to do the same on her next visit. The next visit, she reported that during her batting lessons, her knee popped and she had some pain. Both knees were very swollen today, and she has been icing them at home. She had pain during practice, but it went away after 20 minutes, and I noticed that her left knee was more swollen than her right knee, and that was the knee where she felt the pop during practice. On her third visit, I decided to do the same thing, but I decided to also stretch her quads because they seemed a little tight. And I also added new exercises and progressed some of the others, which she had no problem with. And she did have less pain with squatting from pre to post treatment. And my plan for the next visit is to do the same thing. On her fourth visit, she reported that her knees are improvement, but she still had some pain during practice. And she had better control with functional squat and also less pain, so she did improve her hip strength. By her last visit, she reported a 95% improvement in her symptoms, and she was back to playing softball with pretty much no pain. At discharge, the patient was back to playing softball. She had less pain with squatting and twisting, and all of her swelling was gone in both knees. What I would have done differently was a functional test such as the Y balance, just to get a baseline measurement, and also to see if she was ready to go back into playing softball. And what I learned from this case was hip strengthening exercises are more important than quad strengthening exercises, especially with females, because females do have weaker hip muscles. And how has hypothesis-based reasoning affected my treatment? It just provides a guideline for treatment care. It just helps me figure out where I'm going, make sure I'm on the right track. Thank you for watching my presentation. If you have any questions, just please ask them on Tuesday's meeting.